Good morning and good afternoon. My name is John Herbst. I am the director of the Eurasia Center at the Atlantic Council. I'm delighted to have you join us today for an event on COVID-19 in Russia. We have a distinguished group to talk about the subject with you today. We're starting with Vladimir Milov, a former deputy minister of energy in Russia and a leader of the non-systemic opposition. We have as well Dr. Judith Twigg, coming to you from the Norfolk area. We have a Russian journalist, Konstantin Eged, former journalist for the Financial Times. We have Yakub Kolensky, who's a well-known expert on disinformation, and Wayne Merry, a distinguished American diplomat with great experience in Eurasia. And I'd like to start our event today with a statement pre-taped earlier this week with Vladimir Milov. Please.
Hi, everybody. This is Vladimir Milov from a self-imposed isolation in Moscow, and I'm going to update you on what's happening with coronavirus in Russia and how government is handling this situation. First, you don't have to be lulled by the official relatively mild numbers about the confirmed cases. I think, to my best knowledge, the recent number is 3,500. The government brags about reaching the relatively high testing capacity. They say right now they're doing 36,000 tests a day. However, they already did, I think they surpassed 500,000 tests already. But there are very severe doubts in the reliability of the Russian testing system because we have a number of extremely unfortunate cases from a personal experience, like one of our fellow friends and opposition activists in Kaliningrad recently has been tested positive for coronavirus, but this happened only after a second test, on which he insisted, being in a critical condition for several days, having a fever and difficulties with breathing. I think he's on a ventilator right now. His first test was negative. And only he was bashing on their heads and insisting that they did a second test. They did it, and it turned out to be positive. So the reliability of Russian testing is a big question. Also, the government is trying to use all the possible ways to suppress the real information. Information sharing by doctors from hospitals who obviously know the situation on the ground better. So you don't have a real picture. However, you do have a lot of signs, like we, the Soviet-born people, we have a good skill of reading the truth between the lines of the official statements. So there are several criteria which can allow you to tell that the situation is much more serious than the authorities actually want you to know. First is you really have to watch a very short video of a conversation between Vladimir Putin and the mayor of Moscow, Sergei Sobyanin, who was appointed to lead the coronavirus task force in the Russian government. It's on the Kremlin's website, and it's very telling. Because first, Sobyanin, when he speaks, he looks extremely worried about what happens. And he actually says all that stuff that we fear is really happening. He says that the pandemic spreads at an extremely fast rate, which is very dangerous, that we don't have sufficient capacity in our healthcare system to handle that. He literally says all these words, plus you have a lot of different stuff going down. Just very recently, the government of Moscow had appointed a plan to reprofile hospitals with adding some thousands of new beds to treat patients in critical condition associated with coronavirus. This gives you the idea of scale, how they view is going to evolve over the next weeks and days. And second, from my residential experience, normally in the residential areas in Moscow, you don't have a lot of police. Russian police is extremely lazy and is never present. It's totally absent all the time. Well, not right now. Not right now. I mean, in a different, like during a Chechen war and terrorist attacks in Moscow, you didn't have that many police as we have now monitoring the lockdown. Which is a very telling thing to me, that the government is understanding that the scale of the situation is extremely critical. That's briefly the situation that we have right now. I assume it's going to get worse because listen, that's important. 90% of the confirmed cases in Moscow, as announced recently, are people who never went abroad in the recent period. So this is already, the coronavirus is very deep-rooted domestically, which means that the scale of epidemic might be much worse than we even think, with obviously insufficient government response. So unfortunately, that's the grim reality that we have to face right now. Hi, everybody. This is Vladimir Milov from a self-imposed isolation in Moscow, and I'm
Okay, so we've heard now from Mr. Milov. I'd like to now turn the conversation over to Dr. Twig to talk in general her picture of what's happening with COVID-19 in Russia. Please, Judy.
Sure. Thank you, Ambassador. The latest data that we have as of this morning tell us that there are just over 4,100 cases of COVID in Russia, and that they've performed over 600,000 tests. And as we just heard, the quality, the reliability, and the coverage of those tests aren't clear. We certainly have anecdotal reports of people who are in hospitals with severe respiratory distress, with pneumonia, who have not been tested for COVID. So the real number is certainly higher than 4,100 cases, but it's not clear whether the increase that we are now seeing from day to day is due to genuine continued spread of the virus, or whether we're just seeing the testing regime catch up with actual prevalence of disease. I mean, Moscow only went to serious physical distancing measures that would start to flatten their curve a couple of days ago. And as we know, it'll take about 14 days at minimum for the data that we see to catch up with those distancing measures. There was a study out of the London School of Hygiene and Tropical Medicine just a couple of days ago that ranked about 50 countries on the extent to which their testing for COVID is high quality and comprehensive. And that study ranks Russia relatively high, but it also puts a bigger confidence interval around their numbers for Russia than they do for any other country. And that's an indication of just how much uncertainty we have about what's going on in Russia. What we do see is that the caseload right now, as reported, is heaviest in Moscow and St. Petersburg, but we're also seeing disturbing smaller flare-ups in a handful of regions, Komi, Sverdlovsk, Krasnodar, a few others. Right now, 70% of the reported cases are in Moscow or the Moscow region. So in terms of the health sector's capacity to respond to the pandemic, there are two real issues here. The first is how well equipped the country's two major cities, Moscow and St. Petersburg, are to handle a surge of moderate to severe cases of respiratory distress. And then the second question is whether or not we're going to see significant spread of the pandemic to other cities, even to smaller cities, towns and villages, where there's no question that the healthcare system is much less well developed, would crumble pretty quickly under the weight of a surge of cases. Now, that said, it's a different situation than we had 15, even 10 years ago. There's been an enormous amount of investment in healthcare infrastructure over the last decade. So Moscow and St. Petersburg especially, but also about a dozen other urban centers have benefited from new hospital construction, modernization, new equipment, some new training of personnel. So that's good news. The caveat here is that Russia doesn't really have the kind of big multi-profile hospitals that we have in the United States and in Europe. Instead, they have specialized facilities. So there are infectious disease hospitals, there are maternity hospitals, there are cardiovascular treatment centers. Most of the investment in recent years has been in the things that have most impacted Russia's demographic challenges, which has been smart. They've invested in maternity and neonatal care to bring up their birth rate, a non-communicable disease to get their numbers down in heart disease, stroke, cancer. So one question mark is whether they can make the shift in terms of personnel, facilities, equipment to gear up against this specific infectious disease pandemic. Can they also break down the administrative silos between these separate parts of the healthcare system? There's lots of turf protection, traditionally lack of communication and collaboration across these parts of the healthcare system. So we'll be looking to whether they can break that down. There are also big questions around equipment and training. There's still too much equipment that's old, that's poor quality. Questions about whether they have enough anesthesiologists, whether or not they have enough lab technicians, whether they have enough skilled intensive nursing staff. Putin last week, in the speech that he gave on Wednesday, was kind of oddly subdued. When he announced that week-long work holiday, too many people saw it as a vacation, and so they traveled. They traveled out of Moscow. And so we worry about the spread of the virus from Moscow last week to smaller cities, rural areas where the healthcare system definitely isn't equipped to handle things. Over the last decade, there's been a downsizing of the hospital and the healthcare network as a whole in smaller towns and rural areas, all in the name of system efficiency. So there are millions of people in rural areas right now that have literally zero access to healthcare. The hopeful part of that is that older people in the rural areas generally have less mobility. They just don't travel as much. And so we hope that those people in the rural areas with less care are less likely to be traveling and spreading the virus anyway. One of the big stories here, not just in Russia, but everywhere, is that local and regional governance matters. There's a differential capacity to respond across regions of the country. It's like in the United States, where you have a big difference between Governor Cuomo in New York, who's come across as a very strong communicator, proactive, versus some of the other governors, particularly in the southern part of the United States. In Russia, Moscow Mayor Sergei Sobyanin is Russia's version of Andrew Cuomo. Big contrast to the governor of Komi, for example, which is emerging as a regional hotspot. He resigned just a couple of days ago. So one of the major things we're going to want to do is keep an eye on the flare-ups in Russia's regions, on those numbers, especially in regions where the average population is older and therefore more vulnerable to COVID disease in the central and northwest federal districts. And then the last point I'd want to make is that the American Centers for Disease Control and Prevention released some data earlier this week, making it clear that the people affected by COVID who are most likely to need intensive care, need hospital care, need ventilators, are people with underlying conditions, heart disease, diabetes, lung disease. And Russia, compared to most other countries, has a disproportionate burden of those underlying conditions. Again, it's better than they were 10 or 15 years ago, but those kinds of underlying conditions that impact COVID are driving still a large amount of premature mortality anyway in Russia, especially among middle-aged men. So Russia has a particular vulnerability here, heightened even when you add Russia's disproportionate burden of HIV, tuberculosis, again, weakened immune systems, people more vulnerable. So we worry that a disproportionately large number of Russia's COVID cases will progress rapidly to needing intensive care. If that happens, then even the relatively well-equipped larger cities like Moscow and St. Petersburg aren't going to be able to handle the surge that's coming.
Thank you very much, Dr. Choi. That was a wonderful description of the vulnerabilities and the strengths that Russia has in dealing with COVID-19. I'd now like to talk to Konstantin Eggert, again, a former journalist for the Financial Times, to talk about the political impact in Russia of this crisis, of the pandemic.
I never worked for the Financial Times. I worked for the BBC, but it doesn't matter. Hello, everyone. I think that what we see in Russia today, make no mistake about it, it is the biggest test of the whole Putin system that he's built over the last 20 years. And this is for real. This is not a test. This is not a test against some kind of imaginary threats that Putin's administration is so good at inventing and propagating. Just one interesting observation. All these narratives that were so important for the Kremlin in the last years, like World War II, like celebrating V-Day, like Putin's recent decision to appoint himself effectively a ruler for life with the constitutional amendments, all that is completely, all these narratives are completely swept away and are of no interest. And even Ukraine, is barely present on Russian TV screens. So I think that this is something that will show us basically how effective is this particular authoritarian system. What we've seen so far are three things. First and foremost of all, people do not trust information. As Vladimir Milov said, there is a very old Russian tradition of reading between the lines. And of course, the government spinning it as all other governments in a positive way does not really improve trust. And the fact that the president is being, I would say, a bit remote in terms of his attitude to the crisis doesn't help, really. Number two, what we also see is, of course, a big crisis of centralization that Putin spent the last 20 years creating, banning, for example, elections of regional governors in 2004. Now these governors are put between the rock and the hard place. On the one hand, they have to, as Putin instructed them, to provide some kind of initiative and work according to local conditions. On the other hand, they know that they are ultimately responsible to the Kremlin, that the Kremlin doesn't really know where are the boundaries between what the center decides and what the regions decide. So what ensues, and that we've seen, as Judith rightly said, already in the form of 3 subsequent resignations of regional governors, what we see is confusion. And it doesn't help that Putin has stuffed regional governments with loyalists, not professionals, or very rarely professionals. So basically, these people don't know how to act alone without directives from the Kremlin. Number 3, the economy. Although on paper, Putin granted different sorts of breaks for businesses, but when you talk to business people, they say no instructions are coming to the tax police, to the banks, to whoever, in order to alleviate what happens with the economy, especially with medium-sized and small businesses, which may fold in a month or 2. And just before we started this broadcast, there was news that central bank said, although Putin announced these long holidays until the end of April, bank credits that individuals and businesses took have to be paid on time, which is not exactly a signal you would like to send to basically to businesses, to the economy at such a time. I also think that Putin's favorite foreign policy field, where he was supposed to be strongest, has been revealed as a kind of more of a simulation than a real thing. 2 publicity stunts, sending humanitarian aid to Italy and the United States, were definitely mistakes, because I don't think that any Russian would like to see the Russian government sending medical supplies now to basically 2 very rich countries. That, I think, shows you how out of touch the Kremlin is. With regard to the context in which it all happened, we see the continuing price war with Saudi Arabia and the ruble devaluing very significantly, very small or very much decreased income from oil exports, and increased mistrust towards the Kremlin by a host of international players. It also doesn't help, including it doesn't help Putin inside the Kremlin, basically. It doesn't help him inside his own ruling circle, that he chose to basically bail out Rosneft, buying on paper Rosneft's holdings in Venezuela during this crisis at a cost of essentially $4 billion to the Russian taxpayer. What I think is going to happen, and I'm trying to wrap up now for the time being, what I think we're going to see within a month whether the Russian medical system is able to basically stand up to the pressures. And also we're going to see whether the Kremlin, or basically people in the regions, governors, people like Mayor Sobyanin or Prime Minister Mishustin, who's now heading the overall Russian effort to combat coronavirus, whether they will be able to turn the tide. But this, even if they do, will have significant impact on the future of this political regime, because the emergence of new strong figures that will be proven in the field as effective or even quasi-effective will undoubtedly sap Putin's hold on power in the future. And I think even if this system survives this crisis, which it may, it's the time that is allocated to it by history will be shortened very significantly by this crisis.
Kasi, thank you. Very, very interesting analysis. Yakub, I'd like to now turn to you. Talk about disinformation during this crisis.
Thank you very much, Ambassador, and very glad to be here. I don't see many people currently being quarantined here in Prague, so it's nice to see some faces of live people. Yeah, as you mentioned, I'm trying to follow mostly the disinformation messaging regarding the virus, and since both Judy and Konstantin were discussing quite a lot the internal messaging, let me highlight a little bit about the external messaging of the Kremlin, the messaging that those Russia Today and Sputniks and all the pro-Kremlin disinformation-oriented outlets are spreading in other languages than in Russian. And firstly, what we see is a continuation of the old KGB practice of using every single new disease and new virus to spread anti-US disinformation and conspiracies and accusations that the virus is man-made and that it's designed to target specifically a nation or a race or a country. For those who follow the Kremlin's disinformation campaign, they know the approach from the famous Operation Infection in the 80s, when the pro-Soviet newspaper in India and later in all the world spread that the AIDS virus is actually a CIA creation designed specifically to target, for example, minorities in the US. But they have been spreading similar accusations even before, already during the war in Korea and in Vietnam. And currently we see exactly the same. The virus is described as a purposefully created weapon by the US military, designed to target either the Chinese or just any non-American nation. But we have also seen accusations that it's been created by the Brits, by Latvia. So it's always these messages that are trying to cause doubt in the target audience. Do not trust your mainstream media. Do not trust your authorities. That the virus originated in China. In fact, the truth is completely different. That it's mostly a conspiracy of some evil CIA, FBI, and global elite who are trying to eradicate the world's population. And only the pro-Kremlin media know the truth. Secondly, the other main narrative, apart from the accusations that the virus is created by the Americans, secondly, the Kremlin media are using the pandemic to portray Europe, and particularly the European Union, as collapsing and decaying, that it's currently the end of the EU because the nation states had to close the borders, which proves that the Schengen area doesn't work anymore. And all the quarantines are proving that the whole European project is coming to an end and Western governments are failing. And connected to this is the third bigger narrative, that Russia is actually the one who's handling this crisis brilliantly. And not only they have so few cases of infections within Russia, but they are actually so well off that they can even help, for example, the Americans or the Italians. Here is something that is very similar to what, for example, the Chinese propaganda machine is doing. Here we see quite a convergence between the Chinese and Russians, and both of these regimes are using the crisis to portray themselves as some champions of humanitarian aid that they are giving to the West. Well, in fact, they are just selling it. We are buying it. But the messaging is we are those who are helping to save the West. So these would be the three main narratives I see happening in the disinformation-oriented ecosystem, and we can elaborate on this later in the discussion.
Okay, thank you, Jakub. Wayne, I'd like to turn it over to you now to comment generally on what you've heard and what you think is important.
Okay, thank you, John. And let me apologize, they seem to be having some connection problems. So I hope I won't drop out of the conversation here. I'd like to talk a bit about how Russia's capabilities of dealing with this. And in part, I'm drawing on my experience in a US government-sponsored simulation exercise a few years back about a global pandemic. And I was on the small team that played Russia. And without going into the details of that, one of the lessons that I think came across was that every country goes through a pandemic with the political culture that it takes in. And that's certainly true for Russia. And I think this will be manifest in at least two important factors. One will be the endemic tendency within the system at all levels to deception. It doesn't just lie to others, it lies to itself. So it'd be very difficult for the system even to understand clearly what's going on, because nobody will either tell the truth or the truth will not be repeated up the chain of command. And that's a problem that you simply cannot resolve in the short term. But the second is the enormous Russian capacity of resilience, because they are truly going to be treating this like wartime medicine. And wartime medicine tends to have three components. One is mobilization of resources, and that's something which the Russian system is going to be good at, simply because it is a command structure and it knows how to get commands obeyed. The second is what in the military is called surge capacity. The ability to have excess resources that you can use in a time of crisis. In the United States, we've gone in many respects to what we call a just-in-time approach to things. Well, Russia is the antithesis of just-in-time. No Russian I've ever known would do anything important on a just-in-time basis. And this is certainly true in their healthcare system, where they have, by Western standards, an enormous excess of facilities and beds and all kinds of things. But also because Russia, with the single exception of Switzerland, is the country in the world which has the largest national reserves and stockpiles. They have just incredible levels of reserves, of warehouses, much more of things, everything from bootlaces and lubricating oil to medical supplies, much more so than we have in the United States. And this is stuff that they're going to be able to draw on in their mobilization. But then the third thing that they're going to do, which is redolent of military medicine, is triage. They're going to simply look at a lot of the patients who come in as not worth the trouble. If you take, for example, a Russian man my age who's been smoking and drinking heavily every day for 50 years, if he comes in with COVID-19, they're not going to put him on a ventilator. They're simply going to take the view that he's not worth saving, and they'll push him aside. And these are things which allow a system like Russia's to get through this kind of very difficult challenge intact. And it's not necessarily going to look pretty. And I don't think that the Russian system is going to manifest an enormous amount of high quality medical care, except for the elites. It's not going, I mean, there will be all kinds of shortcomings, there'll be enormous injustices. But I do think the resilience factor is going to be very high. And from that, I'm going to draw a political judgment, which is here in Washington, there are a lot of people who are looking at the pandemic as a means to achieve regime change in places like Venezuela and Cuba and Iran, North Korea, Russia, maybe China and elsewhere. I'm not going to generalize about that. But in the case of Russia, my money says no. I think if nothing else, this will result in regime cohesion. And I don't mean that the regime's performance will necessarily be good, but that the regime within itself and the regime's relationship to the population will be stronger because in the short term and in the near term because of the pandemic. And that people here in Washington who somehow imagine that the pandemic will succeed where US and European sanctions have not in affecting regime change, I think they're going to be disappointed. I think this is going to be a huge national tragedy for Russia, as it will be for a great many other countries, including our own. But they will perform through it in ways that are Russian. And that will be understood by the people of that country.
Wayne, that was very interesting and provocative. I'd like to ask Dr. Twigg to comment on your assessment of Wayne's view of the resilience of the Russian medical and administrative system in dealing with this crisis. Then we'll turn to Konstantin to pick up another thread from what Wayne said.
Sure, Wayne's absolutely right that there is tremendous surge capacity in terms of per capita numbers of physicians, hospitals, hospital beds. Russia has 2-3 times as much as we see in many of the countries in Western Europe and certainly in the United States. The question is whether or not those large numbers of personnel and equipment will be able to cope with this specific challenge. I worry that I'm hearing too many anecdotal stories out of doctors and hospitals in the regions saying, yeah, we have a handful of ventilators, but they're decades old and we're not at all certain that they'll be able to function when We need them to function. One important addition I'd like to make to this story, though, is that out of necessity, stemming back from the relatively low technological level of the Soviet period, the incredibly smart, creative, innovative Soviet and now Russian doctors and scientists and people all over the system got very good at achieving high performance parameters out of very low tech. It's that TV show MacGyver, right? They do things with paper clips and rubber bands and somehow make it work. So the stories that we're hearing out of New York right now, out of other places where they're doing things like making one ventilator extend to 2 or 3 or 4 patients, cobbling together what you have in order to serve your patients the best, I think we'll see that in a very big way coming out of Russia.
Thank you. Konstantin, your thoughts on the cohesion that Wayne sees coming out of this crisis for the Russian government?
Well, I do agree with certain things that Wayne said, including this pyramid of lies that's going to be fed from below all the way up to the Kremlin. That is definitely going to happen. I also think that, yes, maybe Putin's regime will survive this. Of course, we don't know how long will it last. But this image of World War II mobilization that Wayne presented somehow doesn't feel completely right to me. In Stalin's days, or even in Brezhnev's days, in the late Soviet Union, this capacity for mobilization was very much fed by basically a vertical of party organizations. And also, definitely there was corruption in the Soviet Union, but nothing compared to what happens today, which essentially undermines any effort. Also, I think that although no one's speaking about regime change, but this particular period will definitely have an effect inside the ruling class, the ruling clique, the Kremlin, collective Kremlin. Because during this time, there will be people emerging who will be seen as more effective and more hands-on. And frankly speaking, I think that their problem will be, especially if you're someone like Mishustin or Sobyanin, your problem will be to operate in such a way so that Mr. Putin won't suspect that you may get some presidential ambitions in your head. And you may, by the way, if you are performing some real things that impact millions while Mr. Putin is sitting in some bunker near Moscow. So I suppose that what we may see, again, I stress may see, is something akin to early 50s, when after the war was won, disagreements inside the Politburo and Stalin's aging led to fissures inside the Soviet leadership, which splashed into the open the moment Stalin left the scene. So I'd say that fissures will increase, and especially against the backgrounds of open favoritism in the Kremlin with regard to people like, for example, Sechin, as well as we shouldn't forget the fact that Putin appointed himself president for life. That essentially cuts a whole generation of bureaucrats that laid 20 years to get their shot at the top jobs, that shoots down their chances. And together with the crisis, I'm sure it will make a lot of people think about what's their future and whether it's better to sit still or whether it's better to take a risky bet.
I have a follow-up question on the subject. In your initial comments, Konstantin, you said that Mr. Putin has been somewhat remote in this crisis, which in fact is very different from his style of public governance. So what do you make of that? Is that a weakness? Is that him just trying to figure out what to do? What's going on?
Well, frankly speaking, I never considered Mr. Putin, and I wrote about it repeatedly, a very strong leader. He's someone who's strong when everything goes, the tide goes his way. I do think that he is probably confronted, and in a certain way, I pity him. He's certainly confronted now with the realities of the system he created. And the fact that he has to take responsibility for something which doesn't have a good outcome. So it's very clear that he wants to maintain this distance from day-to-day decision-making. In order to then say, well, you know, this bureaucrat was good and I'm going to give him an order, and that bureaucrat was bad and I'm going to fire him. To retain his very important quality as an arbiter between different warring clans inside the Russian ruling class. But I'm afraid that may not, as adolescents say today, they may not work like that. Because actually in such a centralized system, lots of people, including his own minions, will expect him to give orders and to take responsibility. And if he doesn't do that and doesn't do that soon, there will be trouble. And I think that we already see that. He's been talking about extended holiday instead of essentially saying we have a state of emergency, and instead of actually proclaiming a state of emergency, which completely disorients business, because business people don't know whether they can hire or fire people. People don't know whether they have to show up for the job or not. There are lots of things that are happening inside the economy, which basically confuse people. And confusion is something that a strong leader, especially in an authoritarian country, should avoid. That is much more lethal to your reputation than actually making a mistake. So I'm afraid that unless Mr. Putin starts to show significant leadership, he'll be in trouble. And the whole regime will be in trouble, because this regime is based essentially on one person doing certain things. Again, I'm not saying we see some kind of 1953 in Russia or 1989 or whatever, no, including it because the opposition is weak and Mr. Putin spent 20 years making people like Mr. Milov fairly marginal to major narratives. But that it won't be strengthened, the system won't be strengthened, I'm sure about that.
Okay, thank you. I don't see Wayne on right now. Maybe he's having those technical difficulties. Otherwise, I'd give him a chance to jump in. So in lieu of that, I'll turn to Yakub. Yakub, your sense, you talked about the Kremlin play on delivering supplies to the United States and to Italy. Are you able to describe the reaction in Italy? Has this been a plus? Is this a foreign policy plus for Mr. Putin or not?
I have to admit, I'm not an Italian speaker, so here I have kind of second-hand knowledge. But it is true that from what I read, it seems that the Italians are quite sympathetic towards Russia. They had been already before. Russia is definitely one of the most Kremlin-friendly countries in the whole European Union. And I think this operation only helped. On the other hand, as we see is becoming rather usual, the Kremlin TV again overplayed its hand, and they were showing stories about Italians hanging out Russian flags instead of the European flags. In fact, it was just one businessman who has a lot of business with Russia. It was no ordinary Italian. They were showing pieces in Russia 24 about Italians singing Russian anthems. Again, it proved to be kind of faked. So you can see they are overplaying their hand a little bit. On the other hand, it is true that the charm offensive works quite well. It has probably something to do with the fact that Russians have found a kind of a weak spot. It is true that Europe as a whole didn't have the best reaction in the early weeks of the crisis. Many countries were focused on securing the medical supplies for their own people, which meant that the help to Italy came several weeks later. So the Russians have it much easier now to spread the narrative. Where was the West when you needed them? They weren't where, and we were there. So it is true that Italy is definitely one of the more fertile grounds. I would love to hear from you, rather, how the charm offensive worked in the United States. I've seen a nice cartoon by Yolkin. He's actually Konstantin's colleague from Deutsche Welle, isn't he? And so there is Putin over an older man on the bed on the hospital, and he's taking away his respirator and tells him, "Sorry, pal, I need it for my PR," and he puts it in the box that says medical help for the United States. So, yeah, it's true that in Italy it might have worked. I'm not so sure whether it would be as successful in every other country.
In Italy, you had the problem from the Kremlin's point of view that La Stampa was reporting that 80% of the equipment was not usable. And that's now created a little bit of a controversy. In the United States, it's hard to say. Most commentary that I've seen has been deeply skeptical. But how this plays out over time, we'd have to wait and see. And I would expect President Trump to trumpet this, pardon the verb, in talking about relations with Moscow. But I'd like now to give back the floor to Wayne, because Konstantin offered a rather different view than you on the possible political impact of this crisis in Russia. And as I put this back to you, Wayne, I'd like to ask a very specific question as well. If the Kremlin is going to gain from this, what happens with instances like the case of the head of the Alliance of Doctors in the Novgorod province, who has been delivering equipment to Russian hospitals, saying that the government is not quite ready for this crisis, and she's been arrested and even beaten up. Anastasia Vasilova. So please, your thoughts on Konstantin's comments and my question.
Well, I did not hear all of Konstantin's comments because unfortunately I had a connection failure and I was offline for about two minutes.
Bottom line, he thought that the regime will probably be weaker as a result of this crisis.
Well, a lot depends on how you define regime. I'm not saying that there are not going to be significant personnel changes, even potentially including Putin himself, but I don't define the Russian regime as being just Vladimir Putin or even a few of his associates. I mean, if you were to come out of this crisis with Sobyanin as the top dog in the Kremlin rather than Putin, would that constitute regime change? I would be rather skeptical to use an expression like that. I think there are going to be huge systemic failures. And I think there will be massive public blame, particularly at the regional level and at the local level, and much of it will be entirely justified. I think there will also be accusations against the center, and much of that will be entirely justified. But the resilience of a political system does not depend entirely on performance. I mean, for example, you have people in this city who imagine that somehow the Chinese regime is going to change. I don't see much evidence of that. Venezuela, maybe. On Russia, I think I would just bet money on the regime. Let me just make one comment about this plane load of supplies that were purchased or given, or some combination of that going to New York City. I think the political impact of that in the United States will be trivial. Most people won't even know about it. And it's 1 minute story in this cacophony about things. But that doesn't mean that in New York City, it actually may not save a lot of lives. Look, some years back, I spent a week as a trauma patient in Bellevue Hospital, which is the premier trauma hospital in New York. It's a 1,000-bed hospital. And let me tell you, in the best of times, it's a madhouse. They don't have enough of anything. Today, it must be like Dante's Inferno at that hospital. A plane load of equipment and supplies, hopefully most of them usable, actually will save lives. And I think at least in New York City, there will be some residue of positive feeling about it. But its impact on the bilateral relationship, I would say, will be so close to zero. Zero is not even to be measurable.
Yeah, that's my sense too. I want to give Konstantin 1 minute to respond to your analysis, and then we'll turn to audience questions. Konstantin, over to you.
Well, I think, and here it's a real big disagreement. I think that Putin's regime is Putin's regime. The moment Putin goes, it will be a different regime. By the way, it may be worse, although I don't think so. But to my mind, Putin has defined these 20 years, and defined these 20 years also because of his professional provenance, because of his KGB background. I think that whoever comes next, whether it's Sobyanin or Ivan Petrovich Ivanov, it doesn't matter. it will be a different regime. It will be Ivanov's or Sobyanin's regime, which I think will be, I'm sure it won't be a perfect democracy, no doubt about that, but may venture a guess. It will be a bit less repressive, and it will be much less robust in terms of foreign policy, to put it in a mild way.
Okay. We have a question here from Danila Galpetovich of the VOA Russia Service. Could you comment on the Russian flight with medical aid landed in New York, and more specifically, how Russia and China are changing great power competition through these soft power efforts? Who'd like to have a crack at this? Konstantin?
Okay. I think Danila, thanks for the question and good morning to you. I'm not sure that this is such a wonderful publicity stunt for the Kremlin. I'm sure it's not the last one. What is interesting is that the Kremlin still continues with this line of, we are much better prepared than the West, against the background of a very worrisome situation, which becomes even more worrisome day by day. To me, that shows that that's yet another residue, to my mind, of this loyalism which overtakes professionalism, because the orders were given to continue to do this propaganda thing. Probably Jakub knows more about it. And this propaganda continues, in spite of the fact that anyone watching from Chukotka to Kaliningrad and saying stuff being sent to the United States or Italy, I don't think that anyone will be particularly glad to see that, because people know that there are not enough and there are never enough medical supplies in such circumstances. I do not think that the Russians coordinate this with the Chinese, though. But what I do think, that shows that this very cheap point scoring overtakes much more strategic considerations, in which maybe you shouldn't do it both from the domestic point of view, and in case of China, you probably shouldn't do it after it was revealed that you lied, because that looks bad. So I suppose that it's not very, in the long term, it's not a very long, and it's not a very good propaganda stance. I mean, look, worked for corporate PR for some time. If I was advising my company, I wouldn't have said to do that in such a particular context.
Okay, thank you. We have a question from Chris Case from NATO SHAPE. Given the similarities in Russian and Chinese information operation strategies, is there any evidence of Russia and China directly collaborating on this? Jakub, what do you think?
That there actually have been reports in the past 12, 18, maybe even 24 months that Russian state media are visiting Beijing or other regions in China, conducting trainings on how to counter the evil Western information offensive, basically comparing the notes how to conduct propaganda campaigns. And the reports we see from the region, from Hong Kong, from Taiwan, they are showing us that China has become a lot Russified, or how to say it, becoming a lot more like Russia in their messaging. It used to be very much like the Russian propaganda before 2008. We will just show you that China is nice and lovely, and you will love us. And they recently realized that this is not enough, and they also have to have the B, the thing that Margarita Simonian realized already back in 2008. It's not only about trying to show how Russia, how beautiful Russia is. It's also about showing you how evil the United States are, how horrible Europe is, and how collapsing and decayed all you are. And what the Chinese experts are writing in their reports recently is very much like this, that China is becoming a lot more like Russia in their recent information operations, not only highlighting that China is in the right and they are doing everything perfectly, but also trying to denigrate the West or denigrate their enemies, be they in Hong Kong or Taiwan. We see that they are coordinating on the working level, like the journalists from Russia Today. They are visiting the state Chinese media, those media outlets that are designed to spread their message abroad, outside of Chinese borders. So we can presume that some level of coordination is there. If there is some coordination on the level of the regimes, I wouldn't dare to say. I don't have the knowledge. I would suspect that they might be a bit too afraid to let them see their nodes, both the regimes, China, Russia, and China. So I'm not 100% sure that it's coordinated in the highest levels, but we definitely see some level of coordination on the working level.
Okay, thank you. We have a question from Aaron. Do we have any understanding of the distribution of the positive test, hospital capacity, ICU beds, ventilators, et cetera, in Russia? And has anyone built a dashboard for Russia and Eastern Europe? There's great technical experts there to help with this. Judith, over to you.
Yeah, thank you, Ambassador. So there is a website that's been put in place by the Russian government, stopcoronavirus.rf, that gives up-to-date information at the national and regional levels on some basic indicators about testing, about numbers of positive cases, numbers of deaths. But it doesn't drill down in any level of detail at all about how the health system is equipped to respond. It's quite a contrast to, for example, the website that's up from the National Health Service of Ukraine, which gives us those detailed figures for what's happening at virtually all levels of the system in the Ukrainian context. In a public health crisis like this, there are two reasons that you need really good current information. One is so that the people in charge have the data that they need to respond effectively, so that they know where to mobilize, where to transfer resources, how to be setting policy. Then you also need people to have good information. You need the government to have a crystal clear, coherent communication strategy that can tell people what they should be doing and what they shouldn't be doing in order to stop the spread of the virus. I think we started to see Putin understand how important this information dimension is in that extraordinary video conference he had the other day with the regional governors, in which he said to them over and over again, look, guys, I want you to give me the correct, accurate information, not just on paper, not just in reports this time. You really need to do what I'm telling you to do, and you really need to tell me the truth. That's an extraordinary implicit admission that that isn't the way this system usually works, but that Putin is trying to incentivize quickly some different kinds of behavior. To tie this back into the disinformation conversation, there's a real danger of backfire with the Russian-sourced disinformation. To the extent that that muddy message gets back into the Russian public, it muddies the messaging about the extent to which this is a serious crisis. It muddies the messages about what people need to be doing in order to stop spread of the virus. And so the disinformation campaigns right now are a very dangerous game for the Kremlin to be playing.
Okay, thank you. We have a question from Vera Ratsiborinska. What is the impact of COVID-19 on the Russian economy and defense spending? Konstantin, you want to try that?
Yes, I will try, but in a very general sense. First of all, I'm not a specialist on specific Russian military matters, but it is clear that it is clear for now that nothing is clear. And it's just a few weeks. We don't know how it will impact the defense spending. So I pass on that. I can only say that the army will be very much involved if the crisis goes on, and Wayne was quite right indicating that. The army will be very, very heavily involved in basically trying to shore up stuff, including the economy. The state of the economy is definitely very precarious. Businesses are in panic. It is definitely incomparable not only to 2008 crisis, when basically most Russian economy recovered very quickly and was bailed out by the state, but it's not even comparable to 1998 financial meltdown and basically Russian sovereign default, because at the time the situation was different. There were no state-owned enterprises to speak of apart from Gazprom. There was a lot of Russian, or rather Soviet, old Soviet industry or properties that were immediately basically kicked into life by huge injections of cash because of 400% devaluation of the ruble. There was much less state control over the economy, essentially. That is also very important. Today, I think what we see is half measures and very, very little spending. I think that the figures that we hear are that the Russian state is spending on this kind of bailing out the economy no more than probably half a percentage point of its GDP. Most experts here agree that it's too little. But the government is reluctant to do it, as it is reluctant to proclaim the state of emergency, by the way, which I think, according to the Russian law, involves actually using the Russian gold reserves to help the country out. We'll see how they behave, but I think that Putin's instinctive mistrust of business plays a role here. And unless he really turns the tide and says, okay, let's really splash on keeping people going, keeping businesses going, it will be very, very difficult. And very hard. There's one specific thing I want to mention, which also relates to foreign policy aspects. Russia now has millions and millions of guest workers from Central Asia, which very frequently worked in conditions, very bad conditions, without any kind of contract, semi-legally, black cash being paid under the table. These people very soon will be without not only work, but without means. And they can't go back because the country is closed. So what will happen in such circumstances is also, I think, a thing to watch. It may spark increasingly unpleasant social tensions in especially Russian regions.
Okay, thank you. We have a question from Byerly Jr., and I think I know who that may be. And this is for, I think, Dr. Twigg. Since official statements and government data are suspect, what are the objective signposts to watch over the next 2 or 3 weeks to assess the magnitude of the COVID-19 problem in Russia?
I think your best bet is to watch the official numbers that are coming out outside of Moscow and St. Petersburg. Watch what's happening in the regions. That's where we're going to start to see some outbreaks like we've already seen in Komi and in Krasnodar. If those situations start to get worse or we start to see more of those hotspots crop up around the country, that's a signal that people moving from Moscow to St. Petersburg have transmitted the virus to other parts of the country and into situations where the healthcare system is much less well equipped to respond.
And a follow-up question from an anonymous attendee. What is your estimate of the number of cases in Russia? The official data is a little over 4,100, as you mentioned, for today.
I wouldn't dare venture a guess for about another 2 weeks, because that's when I think we'll start to see potential impact of the physical distancing measures that have been put in place. But I do want to land hard on the point that was just made about the situation of the millions of migrant workers who are in Moscow, St. Petersburg, other cities around the country. They don't have one strong advantage that all legal residents of Russia have, and that is access to free medical care. Those migrant workers aren't covered by the system of compulsory national medical insurance, and therefore they are disadvantaged in a number of different ways. And I can very much envision, as was just said, a situation in which the situation starts to become dire, not only among that population, but also among many other vulnerable, disadvantaged populations around the country. And so inequity hasn't been a big subject in the Russian political conversation up until now, but I think it is about to become one.
Okay, a couple of questions. We have no more time really. I'll just ask one last question. A number of questioners have asked about whether there have been cases of COVID-19 in the Russian leadership or the Russian military. I don't know if any of you have information about this.
Yeah.
No. If not, so Wayne, please.
We do know, of course, that Vladimir Putin himself is in self-isolation because he shook hands with a physician in a specialized hospital who now is down, is tested positive, and who is known to have COVID-19. So, I mean, the closest you can get to the leadership is Putin himself, and we shall see. I mean, it is by no means, look, a lot of people in leadership positions in governments around the world are going to die, including in our country and certainly in Russia. And could that include even Vladimir Putin? He's a healthy man, but that doesn't mean that shaking hands with somebody was not a stupid thing to do.
Okay, well, that'll have to be the last word. Wayne, thank you very much. Thank you, Judith. Thank you, Konstantin, Yakub, and thank everyone for coming in and watching us today, of course, for Vladimir Milov kicking us off. Thank you all.
Bye-bye.
Bye-bye.
Thank you, John.